by God's grace, we're just trusting that today's Hangout session will be life-changing for many reasons. A very important topic that we want to talk about today. And I just to say from the beginning that for the ladies, it'd be great if you can get the men in your life to join because of the things that we want to talk about today. So we're going to start in a second or so. I think the first thing I've been instructed to do is I'm going to invite our guest barristers for today, and I'm going to invite them one at a time. We've got 5 guest barristers, but I'll invite the first 4. So let me start with, okay, I'm going to invite Dr. Gbenga Saka. I've sent you an invitation. And then I'm going to invite Dr. Adewunmi Ogunseye. So Adewunmi, I've sent you an invitation. And then I'm going to invite Mobolaji Odushoga. And then very shortly, I will invite, at some point, I'll invite Dr. Debisi Olunloyo. Okay, now, yeah. Okay, Mobolaji is here. Good to see you, Mobolaji.
Thank you for having me, Doctor.
You're welcome. You're welcome.
Good afternoon, sir.
Expecting Dr. Gbenga Saka and Dr. Adewunmi Ogunseye. So just wait for them to join. Let me see if... Okay. So Gbenga, I'm going to invite you again. Okay. Don't forget, I'm the apprentice, so you guys would have to bear with me today. Okay, Gbenga's joined. Thank you. And then Dr. Adewunmi, I'm going to invite you again. Okay, waiting for you to join, Dr. Adewunmi. Okay, just waiting. If you just bear with us, just waiting for Dr. Adewunmi to join. Adewunmi, are you still there? Can you hear? Okay. Yes. Okay, Dr. Adewunmi, I can see you're still following. If you can please accept the invitation. Right. Okay, we're still waiting. Just bear with us for a few seconds as Dr. Adewunmi joins. Okay. And thank you for your encouragement, guys. Okay, Adewunmi has joined. That's great. Okay, yeah, so guys, today we wanted to focus on men's health. It's actually Men's Health Week this week, from Monday till tomorrow, I believe. And interestingly, tomorrow is also Father's Day, and we thought it would be great to talk about this very important topic that unfortunately men don't talk about as often as should. And with us today, we've got 4 guest barristers. We've got Mobolaji Odushoga. Mobolaji is got a background in accounting and finance. Yeah, Mobolaji, and he's an investment banker at the moment. He's going to share his life story with us, and we're going to pick on that. And then we've got Dr. Gbenga Saka, who's a consultant physician and oncologist. We've got Dr. Adewunmi Ogunseye, who is a consultant psychiatrist. And then we've also got Dr. Debisi Olunloyo, who is a consultant general practitioner. So, guys, to start, I thought to read some statistics to all of us, which I actually found quite shocking. I knew a bit of this, but when I read the statistics, I found it quite shocking. And I thought I'd read those statistics just to set the tone and give us some context about what we want to discuss today. Like I said, it's Men's Health Week, and we want to focus on men's health. It's important, ladies, that you please listen and follow, because the men, I'm sure you want the best for the men in your life. The whole idea is that we want to come away from today encouraging ourselves to live better for many, many reasons. So I'm going to share some statistics, and I'll start by, there's this very old English quotation or quote that says, ignorance is bliss. And from where it come from, it's been translated to, what you don't know will not kill you. But we now know that that is absolutely not true, because ignorance is certainly not bliss, and what you don't know is more likely to kill you, and particularly when it's related to health and living matters. So these are the statistics. Very shocking. Now remember, these are just statistics. In a Christian context, I'm not speaking negatively. I'm just reading statistics that are there for anybody to read. The first thing it says, in the United Kingdom, and incidentally, this applies all over the world, but these are statistics relating to the United Kingdom. In the United Kingdom, it says 1 in 5 men die before the age of 60. Now, I found that quite shocking, because that's about 20% of men, it says, die before the age of 60. And the biggest cause of death in men is cancer, of which the most common is prostate cancer. And that occurs in about 1 in 8 men. That's a whopping 12%. But the first shocking thing was that 1 in 5 men die before the age of 65. And, you know, it's interesting talking about the cancers that are the more common one. It says nearly half of the different types of cancers. Remember, I said the most common one that affect men, that men die by, is prostate cancer. Men are more likely to develop and die from all common cancers. Nearly half of testicular cancers, that's another type of cancer that affects men, occurs in the ages 20 to 34 of men. Now, again, that was quite shocking for me, even with one's medical background. Second thing, 50% of men over the age of 50 develop an enlarged prostate, and that's a lot of men. Half of men, every 1 in 2 men will develop an enlarged prostate. Remember, we've already said that prostate cancer is the leading cause of cancer death in men. The third thing, and these are statistics just to lay the foundation for our discussion, it says in the United Kingdom, 1 in 7 men die from coronary heart disease. That is, things that affect the heart, usually starting from the vessels. We'll talk a bit more about that when we go into the medical details. What we usually refer to as heart attacks. It says 1 in 7 men die from coronary artery disease. And that's a lot more than with women. For women, it's 1 in 12. So it's more than twice the number of women who suffer heart attacks. And it says men are more likely to die from, let me use the popular phrase heart attack, but coronary heart disease at a younger age than women. And sadly, we've seen this in a number of occurrences over the last few months and years. There's some very interesting statistics. We'll go into those in a few minutes. And then the fourth thing, 1 man in 10, that's 1 out of every 10 men, now has diabetes. Men are worst affected. They're 26% more likely to develop diabetes, which again leads to heart disease. And then 1 in 8 men, that's 12%, are reported to have mental health problems. These are just statistics that I wanted to put before us so that we can understand the gravity of our discussion today. Men are 3 times more likely to commit suicide than women. I found that very, very surprising. That is, 75% of suicides are committed by men more than women. And suicide is the biggest cause of death in men under 35 years. Now, these are statistics that are, like I said, quite shocking, but enough to bring this very important discussion to our attention. That's why we want to talk about it. And the questions we're going to be asking are, what are the challenges? What are the medical challenges? But then there are other challenges because, as we will find out, men don't take care of their health. That's the big challenge. Men just don't pay attention to their health. It's interesting, the theme for the Men's Health Week this week is, it's a call for men to pay attention to their health and get health MOTs. So I looked at this and I thought, you know, guys, it's interesting that we look after our cars better than we look after ourselves. And that is very, very sad. Because if you're not there, if you're not well, you can't drive your car. But we pay more attention to our cars than to our health. So it's a call for men to pay attention to their health. And we're going to start with just inviting Mobolaji to share his story. Very instructive story. So Mobolaji, over to you. Do you want to share your story with all of us? Okay, Mobolaji. I think you're freezing. Okay. Okay. Yeah, can you hear? Your screen is freezing slightly. That, yeah, I think it's from your end, Mobolaji. Okay, all right, please do so. Yeah. Okay, so if you join again, and then I'll invite you back again in a minute. So guys, if you just give us a minute, we'll wait for Mobolaji to rejoin, and then we'll hear his story. Like I said, quite instructive, and it kind of paints a picture of the challenges that we have as men, where we don't pay attention to our health. And just going over some of the statistics that I read earlier, again, for the benefit of those who are just joining. I found this quite interesting, and we'll talk a bit more about that when we talk about the challenges with men's health. It says that men are generally reluctant to consult their doctors about their health. And there are many reasons. We'll talk about those very shortly. But this I found very interesting, and ladies, I'm sure you'll find this quite interesting as well. It says that married men live longer than single men. Can anybody guess why? Married men live longer than single men. Can anybody guess why? The reason is because it's been found that, remember I said the context is that men generally don't pay attention to their health. It's a big problem. We'll talk through that as we go along today. But married men live longer than single men, and the reason is because their wives nag them to go to the doctors. And that's very true, because a number of times, I can tell you stories that I've encountered, but a number of times when I talk to people, the men only went to see the doctors because their wives, were worried because of one or two things that they noticed. So let me try and invite Mobolaji back again. And how do I find Mobolaji? This yours. MOBO. You can tell that I'm still being supervised. Okay. So I'm inviting Mobolaji again. Okay. And I'm not sure if Funke mentioned this earlier, but please, as we go along, we'd like you to ask questions. So please pop your questions in the chat as we go along. We'll just wait for Mobolaji to accept the invitation. Okay. Hoping that his internet is working okay now. Okay. Whilst we're waiting for Mobolaji, Dr. Saka, can I get you to just speak into the statistics we talked about? What are your thoughts about these statistics?
So, good afternoon. I hope I'm coming on live.
Yes.
It's quite interesting. It's quite interesting looking at those statistics, and they're quite scary. But I think sometimes the best way is to actually stratify it into different age groups, and by that we're able to understand who is more at risk at which level. And although the data is usually broken down usually to under 24, 24 to 45, 45 to 60, 60 and above. But I think to make it easier, we'll group it into three broad groups: the under 40s, the 40 to 60s, and the over 60s. And under the age of 40s, the main or the significant mortality is usually due to external events. And by external events, we classify it as mental health issues and suicide and transport-related issues, road traffic accident. Although we don't usually think about it, but road traffic accident is also a significant cause of mortality in men when we actually feel invincible, invulnerable, and we feel like Superman. We get a supercharged fast car and we want to see how many seconds we can get to 60. So yes, there's always the risk of road traffic accidents and suicide under the age of 40. But as you go from the age of 40 to 60, you're already creeping on in life. A lot of things have started to factor in. You've had enough McDonald's, burgers, and all what's not that starts to affect your blood vessels, and things like heart disease and strokes start to become a significant cause of death. So you're at risk of heart attack, you're at risk of stroke, increase of high blood pressure, and you're at risk of diabetes as well. And once we go over the age of 60, then the main significant disease of age starts to come in, and that is cancer. And so if we actually look at the statistics that Dr. Adiaga pointed out, it actually fits in with all of the things that we see. That significant cause of death will still be mental health issues and stroke, road traffic accidents, cardiovascular diseases, including heart attacks and strokes, and then cancers as we all get older. And we can drill on about the cancers much later on. I think Bolaji is here now.
Okay.
If we want to feed back to him.
Thanks, Dr. Gbenga. So just to summarize again for the benefit of our audience, what you've done, which is really very good, is you've helped to categorize the significant causes of death in men by age. So below 40, below the age of 40, the commonest cause of death is suicides as a result of mental illness. But then there are also additional things, like you said, road traffic accidents, because men are just men. We like to drive fast. And then up to 60, the most common cause of death is cardiovascular disease. Those are the heart attacks and the strokes. We'll talk a bit more about what are the things that cause that, what we need to look at. And then above 60 are the cancers. And then we said the commonest are, of course, prostate cancer. Thank you for that, Dr. Gbenga. Mobolaji, thanks, you're back.
Yes, sir.
So please share your story.
All right.
Yeah.
Thank you very much, Doctor. First, I'd like to apologize for the network fluctuating. I want to give you say thank you for the opportunity given to me, and also thanks to Pastor Funke. It's a good environment to speak about, men's wealth awareness, and I happen to be one of the people who actually experienced some things that I didn't realize was actually happening until just a minor pain I had, which because of that I was referred to the hospital. So this happened. I marked my 50th birthday last year, June. 3 weeks to that, I started having this unusual pain below my back, and what it does, it travels all the way down to my leg, on the left side. So obviously I didn't pay no cognizance to it, because I just thought perhaps it was a muscle pain, or just any kind of pain that will self-healed. But then I realized that it was consistent And because my 50th birthday was, fast approaching, so that took, my focus away from actually looking into it in depth. So, but after my birthday, 2 weeks after my birthday, it persists. And so I was told, and because it was during COVID period as well, I was told to call 111, which I did. And the lady who spoke with me said she will advise me to go to my nearest hospital. She said, I think it's not a major, issue, but because I can't see no GP at the time, so I should just go to the nearest hospital. So I went to East London Hospital. And then as soon as I saw the first person, they did a blood test and then they took it in. And then about 5-10 minutes later, I was placed on the bed with all sorts of plugs on my body. So which I later found out that it was an ECG test. And so after that, so I was told to take a seat. An hour later, the doctor called me in and said, do I want to hear the fact? That he's not going to, play around. He's just going to tell me as he is. And what he just said obviously blew my mind. He said, what the pain you had or you've been having is called sciatic pain. Sciatica pain. That's it. Thanks, doctor. Which is, it's not a big of an issue. But what they've discovered is beyond, the reason I came to the hospital. And the guy showed me the computer, the result on the computer. My cholesterol has gone beyond. My sugar level has shot up to the roof. And the guy said, if I had done any activities that may have triggered something anyway, because I can't remember the medical term he used, that would have led to a cardiac arrest, which is, I think, a heart attack and stuff. And that could be any minute from now. So I sank, in my chair, and said, I'm just looking like a dead man walking, that was his expression. I'm looking at a dead man walking. So obviously I was emotional, and then he goes, no, that's, So he asked me, when was the last time I've seen a doctor or I've actually done a proper, checkup and stuff. I told him, it's been a while. And he said, well, this is one of the reasons why, men drop just like that. Because we don't pay cognizance to, what goes on around us. And because we're too busy, for whatever reason, either looking after the family or working or whatever it is, like you rightly said, Doctor, earlier, that we look after our possessions like cars and material things than our body. But the good news was, it said it wouldn't. It would rather give me a prescription, prescribe me a medication or place me on the medication. But he said it might be too high for me. So let's see how it goes. He then outlined certain things that I should do or I can do. And then also change my diet completely. I was never a fan of veg. And now I'm a poor fan of vegetable now. I will eat vegetable without pleasure, So it really, even up to now, every time I look back to that day, it dawned on me that could have just been, someone just gone like that, God forbid. But God having a way of, reviving or bringing our awareness to certain things that we never pay attention to. It was just a minor pain that took me to the hospital. And then, so, and the other thing that I would also like to share, this happened when I was about 40, this happened. So it was to do with, going to the bathroom, regularly. again, I just thought it was normal. So until I, went to see a friend, and then within an hour, I've been, I've gone to the bathroom for about, 3 or 4 times, and he said to me, "I don't think this is normal." So I went to see my GP, and my GP talked about. I think you mentioned something like what it was, doctor, earlier, to do with the prostate.
The prostate gland, yes.
Prostate gland, yes. And the GP said, so they referred me to a hospital in somewhere in King's Cross, where they did their test, and they said everything is okay, but if you had left it a bit further, just ignore it, that it was numb, then it could have gone worse. And this is a situation where the gland cannot contain, urine as it should, and then it might be dropping off, and in other words, you just find out that you just wet yourself on, not no. So they put me on certain exercise and corrective measures, which I did religiously, and to God be the glory. Everything is okay.
Okay.
So
we thank God for that, Mobolaji. Really thank God, and I say that meaningfully, because the converse is that, and I'm sure most of us on Hangout today would know this. On the converse, we've heard many stories of people, relatively young people, who have literally dropped dead, just like that. From very young ages, we've heard about 20-somethings, 30-somethings, 40-somethings, up to 50-somethings, who literally dropped dead. And obviously, the initial reaction is, what could have happened? But from your story, and we will talk a bit more about this when the doctors give us a bit more insight, is that you were literally close to that happening as well. I can only imagine. I don't know if you know the figures of your cholesterol level and your sugar level, but I can only imagine what levels they were for the doctor to have said you were a dead man walking, literally. And this is the
in this way, there are 3 stages. So it says if it was on the middle stage, that I wouldn't be bothered. It went beyond that, both. So it said literally. That's why it said that was why he used that term, dead man walking, because it showed me the graph on the computer. It's mind blowing.
One question for you, Mobolaji.
Yes, sir.
So the issue with your passing urine frequently and all that, which we now know is as a result of enlarged prostate. And if you remember, guys, we talked about the statistics. 50% of men will develop enlarged prostate. It's actually a large percentage of men, and it's something to watch out for. So that incident happened when you were 40.
That's right. Yes, sir.
And this other incident with your cholesterol and your glucose happened when you were 50.
50.
Between 40 and 50, did you ever go to the GP? Did you do anything to check up on yourself?
See, this is I did, but that was because they sent me a letter to say come in for a checkup. So when I got there, they only just did a BP, and that was it. But up from the time that the prostate thing came up, I was consistent, because obviously they had to monitor me. So from that period, when they discovered that, okay, you're okay now, and then they put me on a corrective measure, I went back to my old self, thinking all is okay, no problem, we'll just move on, until 3 weeks to my 50th birthday. So now, it's like if I hear a tingle in my body, I'm going to this. I might get there and they tell me it's a false alarm, but at least. So I'm very cautious.
Very, very, very wise. Very, very wise indeed, Mobolaji. And I think, guys, and when I say guys, I'm referring to everybody, ladies and gentlemen. Again, ladies, remember what we said. Even though we're talking about men, this is very important for you as well, because we want you to help the men in your life to pay more attention to their health. This is the essence of today's discussion. But the point I wanted to make is that between 40 and 50, when you had this, let's call it a near-death incident, because to be honest, that was really what it was.
Yes,
We
sir.
don't know when your cholesterol level started rising. We don't know when your sugar level started rising. And that's part of the challenge, because when we don't pay attention to our health like that, we will miss the things that we can easily avoid. What I'm going to do, Bolaji, thank you so much for your story. I'm going to bring you back again at some point to ask questions, but we wanted to bring Dr. Debisi on. She's a consultant general practitioner, and the question we want to ask is, why do men not take care of their health? Why do men not go to GPs? So Bolaji, if you don't mind, if you drop off, we'll bring you back later.
All right, sir. Thank you very much, sir.
I'm going to invite Debisi. Okay. I'm learning how to do this. Debisi, Dr. Debisi Olunloyo. Okay, Debisi, I'm inviting you. Okay. All right, wonderful. So, hi, Debisi.
Hi, can you hear me?
Hi, Debisi, how are you?
I'm fine. Can you hear me?
Yes, we can hear you. We can hear you.
Oh, okay. Fantastic.
Thank you so much for joining. I know you're in the middle of another conference, and I'm really grateful that you've taken time to come and join us as we just talk about this very important matter, and as we challenge ourselves as men. So, Debisi, you're a woman, which means that you're married to a man, and I know you have daughters, but I'm sure you have family that are men as well. So this must be very important to you, but particularly also because of your profession as a general practitioner. And before we talk about the causes of these very important things we need to look at, suicide, we're going to talk about suicide, we're going to talk about cardiovascular issues, we're going to talk about cancers. But before we talk about them, what is the problem? Why do men not visit their GPs? What do you see in your practice? What's your experience?
Yeah. So hi, thank you for having me on. I think this is a really, really important topic, and like you rightly pointed out, Pashola, yeah, men don't go to the GP. It's a known fact. The statistics speak for themselves, and even Black African and Afro-Caribbean men do not go. They're worse than their Caucasian counterparts. I mean, I think one of the biggest things for men is that they don't. It's almost like there's no reason to go to the GP. So for instance, the reason I've said that is if you see for women, you have things from the age of 25, you're called for smear tests. If you have children, you're taking your children to the GP. If you get pregnant, postnatal checks. So for women, there are different things that will bring you. So you go or you take your children, and you see things. And also the other thing with women is that if you get a group of women talking, at some point or the other, there will be some health discussion that will come up. With a lot of men, you don't get that at all. And men kind of, I guess, it's the machoism thing. It's like, oh, we're okay, we're fine, no need to, I feel well, there's nothing wrong with me. I can continue eating and drinking and doing as I please without doing anything. And everyone has that. Even when you meet up, when guys meet up, they'd rather talk about money, investments, jobs, what we're doing. They can even talk about hobbies, but health is not one of the big things that they will bring up. And obviously the biggest problem is because they feel well, they say there's no need to go to the doctor. So that's one of the biggest things with men, is that feeling of I'm well, why do I need to go? And possibly also that, I'm the provider, I need to work, I don't, I need to make money, for us to survive at home and things like that. I don't have time to take off time from work to go to the doctors. So those are significant challenges. And like you rightly pointed out when you brought out the statistics that married men live longer than single men, and it's because their wives will nag them, and that's the truth, because women will hear something and say, oh, have you done this, have you checked this? Or a man will say, oh, I had this, and the woman, go to the doctor. I've had so many patients say, look, the only reason I'm here is because my wife forced me to come, or made me promise I will make an appointment. That's why I'm here. So I think those are the things that you see. And then of course it's even when they come, sometimes when you do have a man sitting in front of you and he has high blood pressure, they'll say, oh, but I'm well, I feel well. And they don't recognize that, something like high blood pressure is a silent killer, is a silent disease until it causes lots of problems. And just to disabuse something that I've had a lot of men say to me, in practices, like, yeah, you've got to die from something anyway, someday. I say to them, it's not just death, it's the morbidity. So think about this, that, there's some men who resist taking a blood pressure tablet, for instance, or medication for diabetes, and say, I'm well. And I say to them, do you know that if you have a stroke this minute, you will be put on about 8 different types of medications, no questions asked, you have to take it for the rest of your life. Now, prevention is better than cure, right? It will be good to get you before you get high blood pressure. But even if we do get you when you have high blood pressure, then take your medication, eat well, exercise, and then we could possibly prevent the morbidity. So I know we've talked a lot about the causes of death, but it's also a cause of disability. So, that's one thing that I do tell guys, because I know some guys think, well, whatever, I'm living my life, I'm living my best life, and I don't need to take medicines.
Thank you very much, Debisi. I think very instructive things that you said. If I pick from the last bit, and I think this is a key message for all of us men. If you say a person has to die at some point, yes, we will all die at some point. But the message is that there are a lot of things that we can prevent. And that's what a health check is about. If you can prevent an ailment, then why die at 40 when you're supposed to live till 80? And that's the key message for all of us guys. And this applies to women, incidentally, for all of us. It's just that why we're focusing on this is that women look after themselves better than men. And you're talking about the reasons why men don't come to the GP. I was reading where it says some of the reasons are being too busy. And then the one that struck me says, fearing that the doctor might find a serious problem. Do you encounter that sometimes, where it's because people are afraid what they will find? Do you encounter that?
Oh yeah, definitely. I mean, obviously there's the fear of what you would find out. And sorry guys, I know that it seems a bit like sexist to say it, but a lot of guys are just like, I'm not afraid, they don't want. But there is that fear of, I'll come to the doctor. I know someone said that every time I go to the doctor, they'll find something wrong, so I might as well not go, because then there's nothing wrong, I'm living my life okay and I'm fine. But the day they do a blood test, or they check my weight, or then something is wrong. So yes.
And another thing that just crossed my mind, which I'd like you to speak into, but I know we'll talk about the medical bits earlier, but it just struck me now that some of the things that men deal with, they're more silent than other things. So prostate cancer, for example, is usually very asymptomatic for a long time. And by the time you get symptoms, it's usually too late. The same thing with, like, from Mobolaji's story, if somebody is going to have a heart attack or stroke, there's always the buildup of cholesterol and glucose long before that. What would you say, Debisi? How would you?
So definitely, I mean, those things are, they're big things that, and as you said, a lot of them are silent. So that's why now there's such a big thing about guys, know your numbers, or know your, think about how you feel. partly because and because the pandemic actually helped a little bit, because now we're encouraging people to buy blood pressure machines, have a blood pressure machine at home. Now, it's not to make you take your blood pressure every day, every week, or make you a doctor. I've had somebody say, I'm not a doctor, I don't know what these numbers mean. It's to make you conscious, health conscious, that, okay, I need to take care of myself. I need to have a cholesterol check. I mean, if you're 40 years and above and you've not had a cholesterol check, go to your GP. Say to them, listen, I want to have a blood pressure, I want to have a cholesterol check. They will do it. A diabetic screen is definite. If you have any family history of diabetes, I know that's a big one, because especially in we Nigerians, if you say, oh, do you have a family history? It's like, I reject that in Jesus' name, never, never. You get all that kind of statements, but that's not it. It's just, if you have a family history, you will be checked even earlier. You will be more proactive. So, but from the age of 40 and above, you do want to make sure you've had a cholesterol check. You do want to make sure you've had at least a diabetic screen. You want to make sure your weight has been checked. And that's what people don't recognize, that, with increasing weight, some of these things can cause problems as well. So if you're overweight, obese, you could have other problems like high blood pressure, and it can lead to you can have diabetes as well. So you want to put in that health consciousness. And now, the NHS is also talking about a PSA test for people who are 45 and above, especially people who are African and Afro-Caribbean origin, because of the high risk of prostate cancer, and they are in the highest group. So those are the things. I do want to say that the symptoms of like an enlarged prostate, they might come or they might not, but it's good to be proactive, to know about it, to say, go and get a PSA test. Just get a test. It'll probably be fine, but don't run away from it. It's like the way we tell women, go for your smear tests. Most women are fine, but then if there's something wrong, they can pick it up quickly and do something about it.
Thank you so much, Debisi. There's a question here, but I'll leave it till the end. If you just bear this in mind, Debisi, because I'd like us to bring in Dr. Adewunmi very quickly. It says it has become increasingly difficult to see a GP. If I don't call my GP practice at 8 a.m., then I can't get an appointment. The NHS appears to be overwhelmed. How do we get access to good healthcare? If you don't mind, Debisi, we'll leave that to the end. I just wanted to bring Dr. Adewunmi on for a few minutes, because I know he has another program shortly. So I'm going to invite Dr. Adewunmi. If you're not on already, let me just try and find you, Dr. Adewunmi. Okay, it's Doc. So DOC. Yep. Okay, so Adewunmi, I'm inviting you. Guys, I hope you're finding this interesting. Like I said, the statistics we read at the beginning, and I'll probably go over them towards the end for the benefit of those who have just joined. Really startling, really shocking. And I think they merit attention, just so we can do what is needful. The message we've heard from Dr. Debisi, who was a general practitioner, is it's all about prevention. But whilst we're waiting for Dr. Adewunmi, you're still there, aren't you? I think you're there. I've invited you to come in. Okay. Whilst we're waiting for Dr. Adewunmi, Dr. Saka gave us a bit of a breakdown. Okay, Adewunmi, he says unable to join. What do we do? Okay, Adewunmi, do you want to go out if you can hear, and then join again, and we'll bring you back if you. Okay, there are a few questions. I'm not sure how to keep up with them. Does taking garlic capsules and plant steroids daily help? Okay, we'll come to that. We'll talk about what to do at the end. Okay, can you please put your questions in the question box? It'll be easier to read them then. I know some of you have posted on the chat, but if you put the questions in the question box, and then we can try and go through as many as we can. Now, for the benefit of those who might just be joining, Dr. Gbenga broke down the statistics in terms of the challenges men have, and it was quite instructive. So if we divided our age ranges into 3 categories, under 40 years of age, the commonest cause of death, you won't believe this, guys, is suicide among men. The commonest cause of death is suicide. And we found out from the statistics that 3 out of every 4 suicides is by men, not women. 3 out of every 4. Very, very instructive. And it's most common under the age of 40. Then between 40 and 60, the commonest cause of death among men is coronary heart disease. Layman's terminology, the things that lead to heart attacks and stroke. Anything that affects your blood vessels that will compromise either the heart or the brain. That's the commonest cause of death between the ages of 40 and 60. And we heard from Mobolaji's, okay, Delmi's here. And we heard from Mobolaji's story today, the near miss that he had. Grateful to God that, you know, God caused him to go to the hospital, and they found the phrase that the doctor used was it was a dead man walking. And then above 60, the commonest cause of death are cancers, of which prostate cancer is the most frequent. Okay, Dr. Delmi. Oh, I've invited you. Oh, sorry, let me do that again. Guys, don't forget I'm an apprentice, so let me try again. I thought you had joined. Okay, Delmi, I'm inviting you again. So if we bear those 3 categories in mind, under 40, the commonest challenge, suicide, mental health disease. Between 40 and 60 is cardiovascular problems, heart attacks, strokes. And then above 60 is the cancers. So we'll very briefly look at those 3 categories. We wanted Dr. Delmi to just talk about mental health challenges in men and this very high incidence of cancers. I think Dr. Delmi is still struggling to join. Okay. Whilst Dr. Delmi whilst we're waiting for him to join us, Dr. Gbenga, can you please talk about the challenges in that middle category, the 40 to 60? Actually, you know what? Let's do it the other way around. Let's start from 60 and above. Let's talk about the cancers. You're a consultant physician, and okay, Delmi is still unable to join. We'll try and sort it out for him. So if we start the other way around, so Gbenga, you're a consultant physician and oncologist. Can you just say a bit about this very common cancer problem that affects men, prostate cancer, and then other cancers that affect men? Do you want to talk about that, Gbenga?
Yes. So I hope I don't sound too scary, but I think we need to face reality. Cancer is very common, and it's something we're going to have to face head on. 1 in every 2 persons will develop a cancer in their lifetime. And I'm not trying to be scary. 1 in every 2 persons will develop a cancer in their lifetime. And I've used the word develop. I didn't say die of their cancer. But we also know that 1 in every 4 persons that has a cancer will die of their cancer. Many cancers, if they are picked up early, can be treated radically and can be cured. So that is the first thing to say. Yes, cancer is common. 1 in every 2 people will develop a cancer in their lifetime. And if you look at it, you will know somebody that has cancer, either a family member or a friend. So it's going to be
Gbenga, sorry to interrupt you for a second. Debisi, do you want to drop off just in case and then we'll let Dr. Delmi come on, and then we'll invite you back, because I'd like you to speak into that second category, 40 to 60s. In terms of coronary heart disease. Yeah?
No problem.
Okay. All right, thank you. Okay, Gbenga, please continue. And
So it's not about being scary, it's about facing reality and knowing what lies ahead. 1 in every 2 people will develop a cancer in their lifetime. Cancers, if picked up early, can be treated radically and can be cured, and we don't have to die of the cancer. And even if cancers cannot be cured, they can be treated and you can live with your cancer rather than die of your cancer. And cancer is technically a disease of age. As you get older, the risk of cancer increases. There are lots of things we've done in the past that start to increase the risk of cancer. And when we focus on men over the age of 60, the commonest cancer is prostate cancer. We all know we will all see the signs of prostate cancer, but we sometimes tend to ignore it. It starts with going to the toilet a lot more. So you are waking up in the middle of the night, going to the toilet to pee a little bit more. Sometimes you are finding it difficult to start peeing. Sometimes you are finding it difficult to start peeing. Sometimes when you start to pee, to make you pee, you have to put on the tap. So it's the sound of the tap that enables you to pee a little bit more. And sometimes everywhere you go, you know where the toilet is because every so often you have to go to the toilet. So that may be signs of your prostate being enlarged. And the other thing about the prostate is a little gland at the base of the bladder. It starts about the size of a peanut, of a groundnut, when somebody is small, and can grow to the size of a lemon as people grow older. And the prostate gland will always grow because it is under the influence of your testosterone, and testosterone is produced by your testes. The only people whose prostate cancer may not grow over time is people that have had their testes taken out. So if you're a eunuch for whatever reason, or for whatever reason you've had an accident and your testes have been taken out, then your prostate may not grow. But as long as you have your testes in place and you produce testosterone, then your prostate will grow over time. And the larger your prostate grows, the higher the risk that you may well develop a cancer in it. And there are some figures to suggest that if we took all the men that are 80 and above, or if we do an autopsy on people that have died over the age of 80, more than 80% of them will have a cancer in their prostate. They may not have had any symptoms in it, but there will always be evidence of of cancer in their prostate. So prostate cancer is a very common cancer, and is the commonest cancer in men over the age of 60. Following on that, then you can have risk of lung cancer and colon cancer as well. And those two cancers also have their own symptoms. We know around winter, the government starts to come up with this program that says if you're coughing for more than 2 weeks, you should see your doctor. So persistent cough, weight loss, usually could be a sign of lung cancer. So if you do have those symptoms, see somebody. And when it comes to bowel cancer, this most important risk of bowel cancer, symptom of bowel cancer, is a change in your bowel habit. Some people go to the toilet every day. Some people go every week. If there's a change in your pattern from every week to every day, or from every day to every week, that's a significant change. You should see your doctor. If that is then coupled with weight loss and loss of appetite and fatigue, then until cancer is ruled out, it's what is most likely to be the case. So yes, commonest cancer in men over the age of 60, prostate cancer, lung cancer, and colon cancer. And all of these cancers can be cured. You do not have to die of them if you are well aware of it and you take the necessary precautions to make sure that you are diagnosed about it.
Okay, thank you so much, Gbenga. Again, guys, I know the C word is a word that most of us shy away from. We don't want to talk about it, but like Gbenga said, it's just what happens in life in terms of health. But the good news, and this is the big message we want to get across, is that you can make a difference when you pay attention to your health, particularly. Okay, Delmi's still unable to join. Delmi, can you drop off and then come back again? Okay, and send in a request. Okay, if you send in a request, my supervisor has told me that that's the thing to do. So if you send in a request, okay. So guys, the big message is just being aware of our health. Again, this applies to women as well, but we've heard that women pay a lot more attention. Women will more often talk about their health challenges and more often seek a GP's advice more than men. But one of the statistics we read earlier is that men are 26% less likely to visit a GP than women, and that's a big difference. So the message is that we are conscious about our health, and then as importantly, that we pay attention. One of the statistics that I came across, gentlemen, and this is very, very important. As common as, remember I said, 50%, half of men, 1 out of every 2 men, will develop an enlarged prostate. Now, an enlarged prostate doesn't mean that it will always end up being cancerous. But it's important to note that the incidence of it becoming cancerous is actually quite high. It's about 12% in men. But the good news is that when these things are caught early, they're curable. I know many people who, by virtue of what one does, who have had incidents of diagnosis of cancer of the prostate, but it was caught in time, young, middle-aged, older, and they've been cured by the grace of God. And that's really the message we're trying to drive across today, ladies and gentlemen. It's not to scare anybody about anything. It's to say you can take charge of your health. You can take control of your health by God's grace. You know, let me tell you a quick story of a good friend of mine. She's a lady in America. And I found this out just about a few months ago. Her husband had two brothers. So 3 siblings, they're all men. The father died of prostate cancer. The 2 older brothers of my friend's husband, the 2 older brothers, were diagnosed with cancer, with prostate cancer. They didn't know, they didn't go for any checkup. They didn't know anything was happening. One of them, by the time it was diagnosed, it had already spread all over his body, having chemotherapy as we speak. The other one was caught slightly earlier, but still undergoing treatment. Do you know that despite the fact that father died of prostate cancer, older brother diagnosed with prostate cancer, the next older brother, my friend, did not even go for a checkup. So it was his wife that kept saying, you've got to go, you've got to. Guess what he said? He says, I'm well, good. Oh, incidentally, he's a pastor as well, so it makes it worse. So, I'm good, I'm well. So she called me to put pressure on him, and I said, look, guys, for what? Anyway, guess what? He goes, are you surprised? Would you be surprised to find out that they've diagnosed prostate cancer in him as well? And he had to go and have treatment. And these are stories that just help to draw, to drum home the point. Okay, very quickly, because of our time, sorry, my supervisor is saying something. Yeah. Okay, yes. My supervisor, Pastor Funk, I'm the apprentice. So she's just saying, and it's very true that, again, we find this challenge very commonly amongst Christians, where, we say we have faith. And I'm sure we've had sessions on Hangout Café where we've talked about faith and medicine. I'm sure we have. If not, we will do something. But faith and medicine are very compatible. In fact, part of your faith is that you look after yourself. God doesn't want us to be careless, but I mean, that's probably another story for another day. But the message again, guys and ladies, is prevention is always better than cure. Let's look after ourselves. Now, I'm going to try to invite Dr. Adewunmi because I really wanted us to talk about mental health issues. Very surprising that men suffer more from mental health challenges than women. I'm going to try and invite Dr. Adewunmi again and see. And then, so we can talk about this and then we can let him go. No, I haven't seen any request from him, but I'm just trying to. Okay, just bear with us, guys. Trying to get Dr. Adewunmi again. Do you want to help me? Okay, so just waiting to see if Dr. Adewunmi. Okay, he says my request is not getting sent. What do we do? That's from Dr. Adewunmi. He says my request is not getting sent. Sorry?
So while you're waiting to get Dr. Adewunmi, I'll just make a few other comments with respect to cancer. The government has a screening program, and the idea of a screening program is to try and make sure that we can detect cancer quite early, particularly for colon cancer. Over the age of 50, there's a likelihood that you receive a request from your GP to send a stool test in, and then they will analyze your stool. And if there's any evidence of blood in your stool, you'll be called for a camera test called a colonoscopy. And usually this is used to diagnose colon cancer quite early. With respect to prostate cancer, there's no standardized screening program as at yet, but we're actually encouraging every man over the age of 50 to have a wellness test. And as part of a wellness test, get a PSA done. You can request it, you can demand it, and you should be getting it. You should be getting it done. Black men have a particularly bad prognosis with prostate cancer if it is not diagnosed early. And in the last few weeks, I've had 2 friends who've had to go undergo prostatectomy in the mid-50s. So yes, when you do your annual MOT, you should get a PSA check done. And talking about MOT, if you have a car that has an MOT, perhaps you could tie your car's MOT to your own health MOT. So you do your car MOT, do your own health MOT. And if you do your own health MOT, do a PSA test with it. And if you do cough, and your cough is persistent, then see a GP. And in terms of other risk factors, if you don't smoke, please don't start. If you smoke, please stop. Smoking is related to more than 80% of cancers. With respect to your diet can contribute significantly to cancers, particularly when you eat lots of red meat. And when we talk about meat, white meat, which is fish, is better than chicken. Chicken is better than lamb, and lamb is better than beef, and beef is better than pork. And so when you go out to your hangout in the evenings, please try a bit of chicken Caesar rather than Nwokobi, Isiewu, Ogbono with all of the roundabouts. The other thing is health, our fitness. Exercising about 30 minutes a day, or at least walking briskly for about 30 minutes a day, quite helps significantly. It's one of the things that we try to encourage people to do, because this can significantly increase the risk, decrease the risk of cancers as well. So I don't know if I'm taking up time. If you need to move on to anything else, Pastor Shola, please let me know.
We'll come back to. So we'll round off with just a summary of the things that we can do. Okay, Delmi, if you can hear me, the suggestion is that you should please reinstall and update your Instagram app. If you can please do that. I know you are going into another program, but if you can please do that, it'd be great to hear from you very quickly about mental health issues. Okay, so we're just going to go and talk about, let me invite Dr. Debisi back, and we want to talk about what happens between the ages of 40 and 60. Debisi. Okay, so the biggest challenge between the ages of 40 and 60, incidentally, ladies, this also applies to women, but it's more prevalent in men. There was a question very quickly, so I don't forget. Somebody said, what is prostatectomy? Prostatectomy is the treatment where the prostate gland is removed to treat prostate cancer. There are different things that have come up of recent, but maybe we'll touch on those before we end. So that's what prostatectomy is, just treatment of the prostate to remove the prostate gland. So guys, very quickly, between the ages of 40 and 60, the commonest issues with men, but please don't forget it also happens with women, is coronary artery disease. That's anything that affects the blood vessel that ends up with a heart attack or stroke. What are the challenges? What are the things we need to be paying attention to? What do we do? Because all these things are preventable. What are the challenges with CHD, coronary artery disease? Who's going to go first, Debisi or Dr. Saka?
I mean, I can speak to that. Yeah, that's fine. Yeah. I mean, the main thing really is knowing your numbers. So there's one time, I think at the NHS, we did a campaign saying know your numbers. And one of the important things you need to know are your blood pressure, your waist circumference, your blood sugar, and your weight and BMI. I think those are the main ones. So and I said that before about getting a blood pressure machine. A lot of people say, oh my God, I don't want a blood pressure machine because if I get one, I'll have high blood pressure. No, you wouldn't. You just checking your blood pressure at home, because research has shown that actually checking your blood pressure at home is actually the best place to check your blood pressure, because you're not in the doctor's chair and things like that. And I always say to people that they'll say, oh, well, you don't know what level it is. A lot of blood pressure machines actually come with some funky design that says if it's red, in the red zone, go and see a doctor and things like that. So there is that. So I would say that there also, at least once a year, make sure you have your cholesterol checked, your sugar levels checked. These are blood tests. You need to ask your GP to request a blood test. And like Dr. Saka said, which I thought was really innovative, is every year you do your MOT. Just think about an MOT for myself. I just need to know. And of course, if you have any family history of high blood pressure, high cholesterol, diabetes, a parent that sudden death in a close family relative, or a parent that had a stroke or heart attack young, or make sure you check that. And then the other thing is exercising regularly. Dr. Saka already said that 30 minutes every day, even 3 times a week makes a difference, and also eating healthy. So those things are generally the things you would want to do. No one wants to sort of be so prescriptive and not make you enjoy life. That's not what this is about. This is about checking yourself. And of course, if your blood pressure is high, take your medication. Like, go to the doctor, get prescribed tablets. I always say it's better to be on the one tablet that will reduce your blood pressure than to wait and then have problems. And please don't say I don't have high blood pressure because I don't have a headache. No, that doesn't work. It's not like that. High blood pressure is a very silent disease. I always describe it like this. Think about it this way. If you have a water pump that is pumping out water into your pipes at home, just think about, if the pressure in the pipes go up, the water pump has to work harder to push out the water into the pipes. Now, if that's the same thing the heart is doing, so your heart is pushing out blood into your veins, into your arteries, and it's going around your body. If the pressure in the arteries is going up, your heart starts working harder to push it out, to make you feel well and stay the same. And at some point, it will keep doing that and keep doing that. And at some point, your heart will say it's too much and it will start to fail. And then you start feeling ill. So just think about it. If you're going to catch it before then you want to catch it on time, before high blood pressure has destroyed your heart, your kidneys, your, different things. So those are the things you want to think about as you grow, head into the 40s. Even before that, you want to maintain a healthy lifestyle. I always say below the age of 40, even if it's once a year, know what your blood pressure is, eat healthy, exercise regularly, lose weight if you need to, okay? Or keep to a healthy weight. And yeah, those are the things you want to do as a prevention. I know someone asked a question about garlic earlier on.
Yeah.
Yeah, you can take garlic.
Okay. Thanks, Debisi. Just to guys, just to help to put things in context. So the high blood pressure, cholesterol, what they do is that they cause deposits in the blood vessels that pump blood to the heart. And with time, the blood vessel narrows. So remember, please don't forget, I love Debisi's analogy about the pump in the house that's pumping water through all your taps and all. So with time, the pipe narrows, your blood vessels narrow. So there's less blood getting to your heart and, in fact, to the brain. So it makes the heart work harder. And after a while, the heart just gives up. So people drop dead suddenly, ladies and gentlemen, is because something's been happening underground that you did not know of because you didn't have any symptoms. High blood pressure is ever so silent. And then one day, because the heart has been, overworking, it suddenly gives up. And like Mobolaji's story, it could have been, he just decided to go to the gym one day to build up some more muscles, not knowing that he had diabetes, those 3 things. So diabetes, that's high blood sugar, cholesterol, high cholesterol, and high blood pressure. That's what those 3 things do. They affect your blood vessels, which eventually affect the heart, and then also can lead to a stroke. Debisi, you were talking about weight. I thought to read this out to the gentleman. It says that a waist circumference above 37 inches. So gentlemen, please note this, and ladies, note this for your husbands and your brothers and your children. A waist circumference of over 37 inches is usually an indicator that something is going on. What it means is that if you're big around the waist, you're more likely to be suffering one of these things that we've talked about, and you should do something about it, including losing weight. I remember Funke and I were talking about this a few days ago, that, you know, African men generally have, you know, this preponderance as they grow older, what we call a pot belly. Where I come from, people think that a pot belly is a sign of status and wealth. Unfortunately, it's a sign of bad health, and you're more likely to drop dead if you have a pot belly. And she said something which really struck me, that in amongst our Caucasian compatriots, the people who have money don't have pot bellies because they understand and they exercise, you know, they do what is needful. But anyway, we don't do that. So just wanted to mention that. Dr. Gbenga, do you want to very quickly just speak into this issue of 40 to 60s?
Yeah, anecdotally, looks like Dr. Adewunmi is on now.
Okay.
Yes, I'm on.
Okay. Gbenga, do you want to very quickly, and then Adewunmi will have you speak for a few minutes, and then we'll close out.
So I was just going to say, anecdotally, in Jesus' house, we used to do men's health. We used to do health check generally about 3 or 4 times a year. And one of those things was that we used to produce paperwork that people have their numbers on and that people could keep. We used to do that. Blood pressure, Dr. Debisi, Dr. Adewunmi, and even Dr. Shalai, we've all been involved in it. So blood pressure, which is quite important. Your waist size, which is quite important as well. And we do cholesterol and we do blood sugar. And there are a lot of things that we picked up. And almost like Mobolaji, I remember there was a particular gentleman that we did his blood pressure. It was about 200 over 120, and that was more than 3 or 4 times the higher rate of normal. We spoke to the gentleman, and actually I was quite impressed with him. For a man, I was quite impressed with him, because the next day he took 2 days off, went to see his GP, called his GP in the morning. They were saying, no, you have to book a GP. He says, I'm not asking to see a GP. I'm telling you, I'm seeing my GP today. And he forced his way, saw his GP. By the next day, he was already on 3 medications. He was sent to hospital and started a series of tests. And he came back to tell me, which I was quite pleased about. Separately, there was another gentleman that we saw, high blood pressure, high cholesterol. I beg, leave matter for my tires, that a man no go die. And that was his response to that. Look, leave that matter alone for now. I can't be bothered about it. And said, well, it's your health. It's your, I'm sure, Pastor Shola, I reported that to you at that point in time as well, because it was an issue that sometimes black men just can be very ambivalent about and say, look, I'll deal with it later. But by the time you have to deal with it, like Dr. Debisi is saying, blood pressure will affect your eyes, so it can give you eye, it can cause you to be blind. It can affect your kidneys can be damaged and you have to go on dialysis for life. It can increase the risk of stroke, and with a stroke, you can be bedridden and not be able to do some of the things that you need to do for the rest of your life. And it can also cause heart attack as well. Sometimes you can die from the heart attack. Sometimes it can leave you a little bit more morbid and you're not able to do things. So let's be conscious of it. And there are lots of things that we can do about it to prevent it. And there are lots of, I don't want to make this plug now, but Dr. Debisi has said it. Tomorrow is Father's Day. If your dad doesn't have a blood pressure machine, get him one. If your husband doesn't have a blood pressure machine, get him one. If they have one, do something else. Get them a blood sugar monitor, get them a cholesterol monitor. And there's something else called a smartwatch now, which I can talk about later, because with a smartwatch, you can actually record people's activities. You can actually do your blood pressure on it. And there's a lot more that you can do on it as well. But I'm not here to promote any specific brand. I'm just saying.
Thank you. Thank you very much. Okay, Dr. Adewunmi, very quickly, I know you've got to speak at another conference where you are at the moment, and also we want to, I'm the apprentice, I keep saying that, so I want to make sure I'm well behaved today. We need to finish very quickly. We've already gone over 1 o'clock. So very quickly, Dr. Adewunmi, in 5 minutes if you can, what's this big issue with men and mental health? Why is it so prevalent in men, particularly younger men? Why are suicides the commonest cause of death amongst young people, with 75% more than women? Very quickly.
I think very quickly, I can even do it in 2 minutes. I hope everybody can hear me well
Yes.
properly.
Yes, we can.
I had to reinstall and all that and change names on Instagram. Simply put, everything that's been discussed here today are quite pertinent. And we talked about suicide rates earlier. Every condition Debisi has mentioned, every condition Gbenga has mentioned. I mean, I work as a psychiatrist, and I am not a psychiatric hospital psychiatrist. I will explain what that means. I work in what is called liaison psychiatry, which means I'm a psychiatrist to a general hospital. So I go to the wards in the general hospital. I have a background in general medicine, did a bit of that, did a diploma and stuff like that, found myself in psychiatry. So I still enjoy general medicine. So I went into liaison psychiatry. What that means is that I tend to see the patients who have just been described, the ones with end-stage diabetes, the ones with heart failures, the ones with cancers, the ones who believe or wrongly that becomes.
Okay, you are freezing, Delmi.
Oh, that worsens depressive illness in them. If somebody believes they are dying, if they start to lose, I hope I'm not freezing now.
You're okay. You're okay now. You're okay now.
Yes. If end stage or severe physical illness is perceived as worsening suicide risk, because what happens is when people start to feel hopeless, helpless, and worthless, suicidality risk increases. Despair fuels suicidal risk. Another thing in the young people is that innocently, a lot of them are dabbling in illicit drugs use. Some of these illicit drugs have been made to look somewhat innocent. I don't know if anybody walks, if you just walk, if you take walks, you'll see these shiny little canisters. They are all over the place. They are very common. They are nitrous oxide canisters, laughing gas. The prevalence of it among the youth, of its use among the youth, is getting high. It does lead to psychotic illnesses. So in a lot of cases, I mean, I've had parents bring their children to the accident and emergency department. And the parents, I mean, I had a woman who was holding her rosary and she was counting her rosary and saying her prayers, and she was rebuking the devil and rebuking everything. When we started to interview her daughter, that was in the beginning of the pandemic, and the daughter started to tell me in very colorful language, by the way, because she was just against me on the day. The sort of language she used against me shocked her mother, but when she started to tell us the sort of things she'd been dabbling in, the mother fainted. It was the mother had a bed in A&E before the daughter. And so we are seeing more and more of that. So basically, the pressures of life are worsening: depression, bereavement, effects of the pandemic, job losses, social pressure. The one message I want to add here is this: no matter what is causing the depressive features, what is causing the depressive illness, no matter what it is, it could be job loss, it could be other social factors, irrespective of causation, it is very important that the person gets treatment. Don't trivialize it. Don't cover it at home. If the person needs it, it does not follow that people get prescribed psychiatric medications. Counseling, psychology input, psychotherapy are also options. Sometimes a combination of both. And it is not true that psychiatric medications are addictive. It is not true. It's a myth. So a lot of the time we stigmatize people and we push people away. People who need help, we push them away. And that is the tragedy of it all. So it's about being responsive to people. It's about going with them. It's about walking the walk with them. If you have a friend who's complaining to you of poor sleep, poor appetite, diminished social functioning, social withdrawal, not going out, being sad and gloomy all the time, offer to go with them, make an appointment with the GP, and the A&E departments are there to be used. They are 24 hours. They are always open. Somebody will talk to you there. That's the simple message.
Okay. Thank you so much for this, Adewunmi. I know there's a lot to say, but you just shortened everything. One of the things that I'd like to contribute as well, Debisi said this earlier on, guys, and when I say guys, I'm referring to everyone, both ladies and gentlemen. It's quite instructive that she said, when women gather, women are more likely to talk about everything. You know, you'll talk about your children, you talk about family, and talk about your health challenges. Men never talk about their health challenges. A man would never say, I'm stressed or I'm anxious when it comes to mental issues, or that I'm depressed. There's always this thing about, well, depression is a woman's thing. Whereas we are finding out, interestingly, that a lot more men are getting depressed now as a result of all these societal pressures than ever before. Not to talk of the other real life issues with prostate gland. You know, I was talking to Mobolaji earlier on. For those of you who just joined, Mobolaji was our guest barrister that shared his life story, how he had a pain, a sciatic pain that caused him to go to the hospital. And it was only when he got there that they did tests and found out that his cholesterol and his blood sugar had gone, you know, it's gone beyond the roof. And the doctor literally said he was the dead man walking. Any stress after that, and he could have just had a cardiac arrest. And I say all this to say that the big message for us today, both men and women, but we're eliciting the help of ladies to please join in helping men look after themselves properly, is that the sooner we are more conscious about our health, the more the better we're in terms of preventing a lot of things that end up being leading to mortality. And as we draw to an end, I just wanted to very quickly go through the questions. There are lots of questions. We'll try and go through a few of them very quickly. It says, there's a question says, what are the signs to look out for from a parent's view so we can monitor our young men, like do's and don'ts? I imagine this is talking about mental health.
Yes, I imagine so too. I think the signs to look for are alteration in their well, what I would call their regular or normal behavior, getting withdrawn, locking themselves away, not wanting to talk to you. I mean, the tragedy is that a lot of parents do not have relationships with their children. Now, if you have relationships with your children and you talk to them, when you start to notice changes, when they stop talking to you, when they start to get withdrawn, when they want to take walks out of the house at 9 p.m., at 10 p.m., they don't always go out to exercise. Trust me. A lot of the time, people are meeting somebody down the road. They are collecting something they shouldn't be collecting to come and take, or to go and take something they shouldn't be taking. So it's about alteration in sleep pattern, alteration in patterns of appetite, alteration in their relationship with family, getting snappy, getting irritable, locking themselves away, not wanting you in their spaces. These are signs. And when you also start to see strangers around them, strange friends, people you are not used to, ask questions, because what you don't want is to have your child get recruited into the county lines system, where youngsters are recruited to become drug mules, to take drugs, especially teenagers, because these dealers know that the consequences for teenagers when caught by police is not as severe. So they tend to use children in school uniform to move drugs around. Sometimes that pizza delivery in the dead of the night is not just pizza. Underneath that pizza, there's something wrapped in cellophane. A lot of pizza is actually not delivery. So be careful about what your children are ordering and how they are behaving at home.
Okay.
Thank you.
All right. Thank you for that. Okay, guys, I'm very conscious of time. What I'd like us to do, so Gbenga, Debisi, and Adewunmi, what if I said to you, what would your last word be from your perspective? We've talked about a lot, and there's still so much we can talk about. This was really just to bring a little bit of awareness and challenge men particularly. I love the catchphrase for the NHS Men's Mental Health Week, and the catchphrase is take charge of your life. It's to challenge us to take charge of life, because you really can't. Don't leave life to chance. There's a lot that we can do to prevent a lot of the things that happen to people. Those statistics that we read, and I'm going to end by reading the statistics again for the benefit of those who joined later. All those statistics are because people are not doing what they're supposed to be doing. So I'm going to start with Debisi, and then Gbenga, and then Adewunmi. If I said to you, just summarize, what would your last word be in terms of men's health challenges? What advice would you give? And we'll go around like that. So Debisi, do you want to start?
Yeah, I mean, for me, I think the biggest thing is just knowing your numbers, know what your blood pressure is, know your blood sugar, cholesterol, and know what your waist circumference and what your ideal weight should be. If you know those things, you are well on your way to taking control. If everything is normal, fantastic, but make sure you do that once a year and keep an eye on it. Buy yourself a blood pressure machine. Check your blood pressure once every 6 months or so, if it's normal. If it's not normal, you need to check it. And please book, if you're on medication, take your medication regularly. Do not stop any medication without speaking to a doctor. And for every man that is 45 years and above, especially Black, African, Afro-Caribbean, you can get a PSA test. If you've not been called by your surgery, you can call them and ask them for it. And if you have a family history of prostate cancer at any age, you can ask for a PSA test. So those things, all those things are really important. And just one more thing, Doc, because someone asked the question, it's really difficult to get a GP appointment. Can I say that it is a narrative? I'm not saying it's not tough. I really am not saying that. I'm just saying you can access your GP. So now most GP surgeries have an online consultation request. You can book a routine appointment. If you call on the day, they'll tell you there are no appointments. You can say, okay, I don't want an appointment today or tomorrow. I can have one in 3 weeks. You can get the appointment. You can request it online. You can ask for a phone call consultation. Don't give up. It's there, and you can access your GP surgery. Don't say it's impossible because everybody on the news. And look, even me, for me to get to see my GP, I have to walk into the surgery and book an appointment. Okay, so I'm just explaining you can get those appointments if you try. And you might have to try really hard, but you will get the appointment. Sorry.
Okay, thank you so much, Debisi. So know your numbers. That is, please check your blood pressure. It's so important, guys. It's so simple, but yet so definitive in the sense that it can help one catch rising blood pressure very early. I've had numerous experiences, and I'm sure the guys will tell you as well, numerous experiences where people turn up with, I think it was, I'm not sure whether it was Gbenga or Adewunmi that mentioned end-stage disease. So either end-stage heart disease or end-stage kidney failure, or what's it called. For it to get to end-stage means something must have been happening for years. And that's how silent blood pressure challenges. It doesn't just happen overnight. Whereas if we get into the habit of checking our blood pressures, you can catch a lot of these things very quickly. They are totally asymptomatic. By the time you start to have symptoms like headaches and weakness and stuff like that, it's because something has been going on for a long time. So please from Debisi. It is know your numbers, check your weight. If your waist size is above 37 inches, don't think it is evidence of good living. It is more likely going to predispose you to diabetes. If you have a pot belly, my brother, please do something about it. Not only is it not, yeah, anyway, you understand, but we're talking about health now. But seriously, let's take this seriously, okay? Thank you so much, Debisi, for that. Gbenga, last word, summary.
Yeah, I think Debisi has stolen my thunder as well, because I was just going to emphasize the same thing. Know your numbers and avail yourself of the opportunities that are out there. All your numbers are significant. And once you've gone over the age of 40, those numbers become a lot more important. Your blood pressure, your blood sugar, your cholesterol, your PSA. And every so often, the government will come up with a campaign. In November, we change the N to M. It becomes Movember. Avail of yourself of the opportunity there. Get your PSA check. Check your balls. Make sure that they're in the right places. If you are weeing abnormally, go and get a PSA test done. If there's any change in your bowel habit, constipation to diarrhea, diarrhea to constipation, seek help. This help is out there, and please avail yourself of it. And more importantly, I'm going to make a plug for cancer cancer services now. You've got Cancer Research UK out there. You've got Macmillan also out there. Support them. Sometimes if you start to put your money into things and you are investing into, you may feel that you have to take something back in return, and that may be your own way of trying to give something back and getting something back. But more importantly, know your numbers and know the numbers that you need to know.
Okay, thank you very much, Gbenga. So knowing your numbers, again, blood pressure, these are significant health things that affect our health, particularly in the ages of 40 upwards, that lead to heart attack. We commonly call it heart attack or stroke. And then, guys, I'm sure you will agree with me. In the last few months, the last few years, there's just been so many younger people that we've heard just, 1 minute just died. Nothing that supposedly provoked it. And all of these things are because some underlying disease, or some underlying process must have been going on for quite a while that people didn't pay attention to. And just taking from Dr. Saka's summary, emphasis again for men, the three commonest cancers in men that cause mortality are prostate cancer, skin cancer, and colon cancer. All these things are preventable if we just check regularly. So part of the screening, apart from checking your blood pressure, is get at least yearly PSAs. That's the prostate. It's a blood test that just tests for the antigen to the prostate gland that shows whether there's anything happening or not. And if you're checking them regularly, you can actually keep an eye so that if anything starts rising, it can be caught quite quickly. Many people that I know that have done that, and thankfully to God, they've been treated. And oh, I forgot to mention this. Maybe I did actually. 98% of prostate cancer that is caught early is treated and cured. 98%. That should tell you something. So technically, what it means is that no man has any business of dying from prostate cancer. That's what it really means. And I know God will determine however a person goes, but we don't have any business dying of prostate cancer if we're doing what we're supposed to be doing. And then the same thing applies with colon cancer, where if you notice differences, you go for a checkup. Okay, Adewunmi, last words and summary from you.
Yes, simply put, I would just say that if you follow the advice that Debisi has given and the advice that Gbenga has given, you'll be less likely to end up with a severe physical illness, which I did say earlier, predisposed to depressive illness, and consequently raises the risk of suicide. Now, mental illnesses are not, mental disorders are not necessarily inherited or coded in the genes. It's about how we react to the pressures of life. That attention to your health, that attention to investing in exercise, in good dietary practices, in not smoking, in not abusing alcohol, in not abusing drugs, in planning, not leaving things to the last minute, and consequently reducing the pressures of life is an investment towards your mental health. Now, when I see people and they say to me, oh, I'm not going to do this, or I don't want to do that because what will people say? I say to them, the mental disorder is not different from diabetes, for instance. It's not different from high blood pressure, for instance. And sometimes I've had occasion to say to people, I think I spent all the years I spent studying to come and cause you damage. I did not. So the fact that we tend to stigmatize people with mental disorders and put labels on them is unhelpful. What we need to do is to understand that we are not divided into compartments. We are whole. And this Royal College of Psychiatrists puts it this way. It says there is no health without mental health. That is the motto of the Royal College of Psychiatrists. There is no health without mental health. It all works together.
Yep.
And investment in yourself will help your heart, will help your lungs, will help your liver, will help your legs, will help your prostate, and will help your mental health.
Okay. Thank you so much, Adewunmi. I'm going to share my own summary very shortly, but some questions that came up with it says, can Dr. Gbenga talk about smartwatches quickly, please? Quickly, please.
Smartwatches are really Fitbits, Samsung smartwatches, Apple smartwatches, and I think there's Garmin and possibly the other ones. But the idea is that, particularly women, it tells you to do 10,000 steps a day, and from start to the end, you'll be able to monitor the number of steps that you do a day. But I gave a particular illustration on the particular Saturday morning. I woke up, went to the bathroom, had my shower, came back, and that was it for the rest of the day, because I sat down at 12:30 to watch football. At 2 o'clock, I sat down to watch motor racing. At 4 o'clock, I done football again, and I think by 6 p.m. I started to watch Sky News. And so when I looked at it at the end of the day, I had not done up to 2,000 steps, whereas I was meant to do 10,000 steps a day. But many of the smartwatches these days also can check your blood pressure, can check your heart rate, can also check your oxygen saturation. So it's just a way for you just to keep yourself under check and to monitor yourself.
Okay, that's great. And your story is very instructive, because I think that's what most people do. And then very quickly, are we going to get JHA health check back post-pandemic? Yes, by God's grace. I thought about this, that it's important that we do that. And like Gbenga said, we've had health checks in the past where we discovered men walking around with blood pressures of 200 over 140. That's literally inviting death any minute. Thankfully, they did something about it. Could you expand on what numbers are important to monitor? So far, I understand blood pressure, cholesterol, blood sugar, waist size, and those are really the things, including for men, doing your PSA blood test. That's very important. So those are really the important things, checking your BMI. A BMI above 25, and BMI, correct me guys, this is a factor of weight, height versus weight or something like that, yeah? Because there's a certain weight that is ideal for a certain height. If your BMI is over 25, you are overweight. If your BMI is over 30, you are obese. And you're more predisposed to all these things we talked about, diabetes and so on. But we're going to end, guys, because we spent quite a bit of time. And thank you, all of you, for taking so much time to be with us today. My last word is two things. Number one, men, please talk. The big problem is we don't talk. Women talk more than we do. Men talk about these things. There's no shame in talking. Talk amongst each other. This is the challenge that I'm going through. I'm experiencing this. And, you know, from that, it will lead us to taking action. If you don't talk, then nothing happens. And God forbid, you're finding out, well, by God's grace, God will intervene somehow. You know, I wrote here, I said, don't just pray, talk. You know, praying is great, but if we talk about things and we are preventative, which is the second thing I wanted to end with, that this whole talk today, if anybody said to me, what's the big message? The big message is we can prevent a lot of the things. Oh, somebody put Soros, okay. The big message of today is that a lot of the statistics that we've read, 1 out of every 5 men dies before the age of 65. That is very shocking. You can change that. We can change that if we take responsibility for our health and we talk about our health. The biggest challenges we've already talked about: suicide among men, heart disease, strokes, and prostate cancer. It says 50% of men develop enlarged prostate. That's 1 out of every 2 men. And like Mobolaji said, you know the symptoms. You're not peeing as you should. You're peeing frequently. Nobody talks about this. We don't talk about it at all. It says 1 in every 7 men die from coronary heart disease. And we talk about what causes that: high blood pressure, cholesterol, and all that. Talk about these things. We can prevent them. 1 man in 10 has diabetes. We can change all of that. If we watch our diet, if we eat vegetables more, we were all laughing when Mobolaji said he is now a vegetable addict. I don't like vegetables, but I think Mobolaji, from today's story, I'm going to start eating vegetables. And then it says 1 in 8 men have mental health problems. 75% of suicides are from men. These are all statistics that we can change, ladies and gentlemen. And the message is, let's take control of our health. Ladies, please help your man, the man in your life, to take...
Can I add something quickly?
Yes, please.
To the vegetable thing. Anybody will probably remember when the Euros was on and men like to talk about football. There was a conference where Ronaldo, the footballer, was meant to talk, and they had Coca-Cola on the table. He took off the Coca-Cola, yes, replaced it with water, and he said, drink water.
Water, yes. In fact,
so with your vegetables, drink water.
Very,
I am learning.
Yes. Yeah.
I have it here.
Very important, guys. Drink plenty of water, at least 2 liters a day of water. I know people who don't drink water at all, and that's not good for your system. At least 2 liters of water a day. But before we go, yes,
no, I'm saying that I'm one of them.
Okay.
And I've just learned, when I had some pain in my back, it turned out to be from my kidneys. And thankfully, it was just an infection. It cleared after a few days. Now I drink 6 of this every day.
Oh, I think I'm planning, by God's grace, to share the testimony one of these days in church, because it was a very dramatic one. I had a series, I had a period over 2 or 3 years that I had kidney stones. Very painful. More painful than labor. I can assure you, ladies, more painful than ladies. I'm telling you, honestly, more painful than you saw the way I was crying. It's worse than labor. I've seen you in labor now. It's worse than labor. Okay. Anyway, trust me, guys, 2 years, it was really bad. And I went to the doctor. The guy said, just drink water. Do you know, before then, I never used to drink water. Now they'll tell you I drink at least 4, 5, 6 pints of water every day. But all of that, we must end by just saying, gentlemen, take care of your health. Ladies, help us to take care of ourselves so that our husbands, our fathers, our brothers will live long, so we all grow old together. Last word, and we'll end. Debisi said it. The same way you look after your car, gentlemen, please look after your health. If you can do an MOT on your car once a year to make sure that your car is roadworthy, at least do an MOT on your health once a year. Guys, thank you ever so much, Dr. Gbenga Saka. Thank you very much, Dr. Debisi Olunloyo. Thank you, Dr. Adewunmi Ogunseye. And then Mobolaji Odushoga, our guest barrister. Thank you for sharing that very enlightening and instructive story about your life. Sorry we couldn't bring you back on because we're talking about all this medical stuff. Guys, thank you very much. And yeah, have a great afternoon. Do your MOTs. God bless you.
Thank you, sir.